Hi, everybody. We wanted to take a minute and do a video memo post the most recent staff meeting to try and recap some of the items that we discussed. So I'm going to fire through these pretty quickly just so the video is not terribly long. COVID update. Numbers are coming down, which is good. Vaccinations for the staff is where we want it to be. We're in excess of 90% completely vaccinated, which is great. There's still concern of us being able to spread the virus, so we're going to continue to mask around the station, in the truck, and follow the same levels of PPE, laundering requirements, reporting to 211 if you're assigned at 212, etc., until we get updated guidance from medical direction and the CDC, which we hope should happen sometime soon. But for now, all things are status quo, follow the policies as they're set out. Psychiatric patients, there's been a couple issues recently where there's been some discussion about whether or not we do or don't transport psychiatric patients. It has always been the policy of Ross Westview EMS that psychiatric emergencies are, in fact, a pre-hospital care emergency, and we will do everything in our power to help solve that problem in collaboration with the police department. There will be some circumstances where they transport, and there will be some circumstances where we transport, and our expectation is that the crew and the supervisor will work closely with our law enforcement partners to pick the transportation method that best suits the patient. We do not want to see 85-year-old nursing home ladies with walkers being stuffed into the back of police cars if we can provide that service and it's more comfortable for them and more appropriate for them. So the presence of a medical condition certainly makes it an EMS issue. The presence of violence requiring handcuffs and restraint makes it a police issue. All the ones in between, we're going to work together to solve the best way we can. We'll be releasing a modified policy for that and some shift training on that, but please rely on your supervisors for guidance, and please be open to solving those problems cooperatively with police. Montroy Road remains closed, will remain closed for an additional 6 weeks. Please follow the detours as posted. It's still up on the status board in the 211 staff office. Along with that, the construction folks are still using the training room at 212. We understand that that's a bit of an inconvenience, and we appreciate your patience as we work through that. There was some discussion about whether or not water could be used at 212. That is specific to the fire department. They don't want to be washing the fire apparatus in the station there for fear of getting their gear wet. They're washing their fire apparatus at their other station. There is no problem with the water at 212. You guys can wash the ambulance. You can drink the water. There's no issue there. So thank you for bringing that forward and clearing up the confusion, but nothing that we need to worry about. System status management during times of bad weather. We may elect to put a truck at Sheets on Mount Nebo to get closer to Ohio Township as weather dictates. Sorry for getting a little distracted there. I was listening to a call. Our response times to Ohio Township are already a concern, and when weather is bad or traffic is high, we may take some steps to make sure that we get you there as quickly as possible. So on days where you know it's going to be snowing or extraordinarily cold or icy, please plan accordingly. You may be in your truck for a little bit longer than expected. Staffing, as you all are well aware, we're in good shape for staffing. We're actually at 1 FTE above what we need to fill the schedule, which I like because it gives us some depth, some ability to focus on things other than just EMS calls. We can get some rescue training done. We can get some rescue driving done, some administrative tasks and facility tasks around the station completed. But the downside to that is it limits the number of hours for our part-timers. So we're trying to infuse part-timers in sporadically on days when we have some focused tasks that we want to get done. And I've asked the part-timers to let me know if there's a particular day that they want to come in that maybe isn't listed as open, so we can keep getting them exposed to the organization. As such, it's not very likely that we're going to do an April hiring in 2021. I mentioned at the staff meeting, if you have somebody that's of particular interest to the organization, you could send them my way and we could talk and try and figure out a way to do that, but we're not going to be doing a newspaper posting and testing as we typically would. Volunteer interest is high, so as we work through that, we ask that you please be accommodating and do the good job that you always do with training when we have folks come through the doors. We like to see those volunteers engaging in Ross Westview EMS. We're trying to find other ways to engage people at different levels, including administratively and on the rescue truck, all of which are very important to the success of the organization. The more volunteers we have come in, the more trucks we can put in the streets, and the more time you all can get on special projects or the rescue truck. It does not mean that we're going to limit the number of shifts that we give to part-timers or full-timers, as we've stated before, but just to reinforce that volunteers augment the staff. They do not take away from the staff. Students, we have a variety of paramedic students, I think as many as 8 coming back in the spring. So plan for a busy educational session here very soon. It's actually started just in the last couple of days. So as you see the students walking around, please engage them and be welcoming. Started working through the 2021 wish list and purchasing items off of that list. We're hitting the low-hanging fruit first and then working our way through that. I think furniture is probably one of the next things on there. House bags will be coming up here soon. We're going to talk about that specifically at the end of this. Working on some paving on the back street and the back lot and some additional landscaping, so building improvements will continue. If there's any items in the building that you think need attention, lights, bathroom issues, fixtures, please let us know and we'll make arrangements to get those things taken care of. We're using that time accordingly with the part-time hours that we had previously discussed. A vehicle update, all of the vehicles are currently in good shape. 214X remains outfitted for rehab but can be configured as an ambulance as needed. The other 6 ambulances are all in very good mechanical shape, and knock on wood, that's a good situation for us to be in. We've certainly had our problems with the fleet over the years. So anything that you identify as a problem, no matter how small it is, something as easy as a loose handle or loose seat cushion or a light bulb out, let us know so we can get that fixed, because now is a good time for us to focus on all those little lingering things that we want to get taken care of. Brian's been working diligently on the insurance, and all of our medical insurance is updated for 2021. The budget is complete for 2021, and as you may well guess, that was a bit challenging after the COVID year. So we're hopeful that we can keep moving on all the projects that we have set out to do, but there is some uncertainty with budget and call volume based on all of the COVID issues going on. So raises did go into effect a couple pays ago. If you have any questions about your raises, please see me or Brian. We'd be happy to answer that. We spent some time in the staff meeting talking about documentation, signatures, demographics, and face sheets. The more information you get and the more information you put in the chart, the better off we are at getting the bills processed quickly and successfully. So we ask that you please be explicit in the detail that you put in the chart. Even if it seems straightforward, sometimes because of billing codes, it's just not that straightforward. I sent an email out that was authored by Deb Lowry of the billing office. So I'd ask that you please take a moment to review that email and that document so that you can help make their job just a little bit easier and keep the revenue flowing into the organization, so we can keep getting all the things that we want to get to keep making our jobs clinically better and more fun. So Ansef Study is underway. Mike Mitchell was the only one to give that so far. So if you have an opportunity, just a reminder, open fractures or compound fractures that the skin is close to being broken, but not broken, we'd still consider that an open fracture. Please hang that Ansef and administer it accordingly. Just remember those patients should be going to a trauma center, not to an outlying facility. And if there's any issues with that, let us know. It sounds like the ER was a bit surprised that we had hung that. So if you run into that, just keep us posted. We have to report back to the state on each of those uses. So the goal is to eventually have that as a state-approved drug list. The belief is that the earlier we deliver the antibiotic, the better off the patient does in the recovery. So we certainly want to be a part of that. Toradol has been added to the trucks. It has not been administered very widely yet. It is what we would consider an intermediate pain medication, maybe useful in somebody that has some concern about taking opioids for one reason or another, maybe useful in somebody that has mild to moderate pain. But somebody that would fall into that open fracture category, we probably don't want to give them Toradol. They're probably still a candidate for fentanyl or morphine or nitrous oxide. So please use that medication as it's intended, not to take the place of fentanyl or morphine unless there is some specific reason why those medications cannot be given. Just a reminder, it's 15 milligrams IV, 30 milligrams IM, unless there's some allergy to that medication. The APP response, Advanced Practice Providers response, is temporarily suspended while we work through some issues with Allegheny General Medical Command and the Pennsylvania State Bureau of EMS. We just want to make sure that we're following those policies to the best of our ability and not causing anybody any heartache. And we believe we'll get that solved here very soon. We've had pretty good feedback on the bender lifts. We're going to be adding a couple additional bender lifts to get one on each vehicle so that we have consistency on the equipment in all of the trucks. Monitors, we want to make sure that the monitor that's numbered for the truck is the truck that it's in. So 41 should be in 214.1, 42 and 214.2, etc. And all of those monitors should be set up standard. Uh, all of the equipment in the truck should be in the same location. The bag, the monitor, and the oxygen should be stored in the inside-outside compartment. Nothing should be in the walkway or on the floor, particularly as students start to come back in. That consistency is important for safety and deployment, but we also want to make sure that we're doing things the same way every time that we possibly can. Equipment to the patient's side, just a reminder that it is a policy that the bag, the monitor, and the oxygen go to the patient's side on every single call. Regardless of what we're told by QRS, you should still be taking those items to the patient's side. It is not the responsibility of the QRS agency to tell us what ALS equipment we may or may not need. Certainly, we appreciate the information that they provide, the assessment, the bleeding control, the oxygen, the CPR, the defibrillation, but advanced medical decisions should be made by advanced providers on our ambulances, not by QRS. So all of that equipment should continue to get to the patient side each and every time. Airway stats for 2021, knock on wood, are 100% right now. That is through consistent training, consistent use of the checklist, patience, and proper setup on scene. So please continue to do the good job that you are doing. Last year we were doing very well, and we kind of fell off towards the end of the year with a couple bad airways, but we want to maintain those stats as much as we possibly can, mostly because it's the right thing to do for the patient, but also because we want you to have the best educational and clinical experience that we possibly can. So please keep doing a good job with that. QA has been exceptionally well done recently. Chart completion is excellent. So please keep doing a good job of getting your charts turned in. Thanks to Bill for doing a great job on the chart audit. I know some of you find that as frustrating, but from an administrative perspective, it is very beneficial to us, and it has certainly been very helpful in statistics and chart management. And so while you may find that frustrating, it's been much beneficial to the organization. And QA at the S1 and S2 level has gone well as well. A number of people have been working hard to push those charts through. So thank you for that. The last thing I'll throw at you is I'll be putting a survey out today for some equipment items. And we want to look at the IV boxes in the truck, specifically the house bag, the intubation kit in the house bag, the IV kit in the house bag, whether or not we need to continue to have the COVID kit with the blood pressure cuff, the stethoscope, the thermometer, and the glucometer in one kit, or whether that could just go back into the bag. We're going to have a series of house bags and IV/airway kits coming in for you guys to check out. Whatever you collectively decide is what we'll do as an organization, but whatever that decision is will be consistent across the board. It will not be an opportunity for anybody to modify a truck on a given day. We're a busy organization pushing 10,000 emergency calls a year with 6 different vehicles. It's difficult enough moving from truck to truck with different equipment in different locations. The bag, the monitor, the oxygen, and the suction need to be consistent each and every day. They're critical life-saving items, and we should not be searching for things or changing things. So whatever we decide collectively is the way it will be, and we'll all work with it. No matter who likes it or doesn't, the masses will get to decide. You guys have to use it, but consistency is critically important. That's all I have for now. Thank you all for taking the time to come to or Zoom in on the staff meeting. And if you have any questions about that or the video or any of the equipment items, please let me know. And have a great weekend.